As we learn more about the COVID-19 vaccine rollout, paramedics are voicing frustration over when they will line up to get the shot. Today, I spoke with an emergency responder who became infected with the virus, and she worries about the consequences if paramedics have to wait.
I can't count how many COVID calls I've been on, to be honest with you.
Vanessa Viss has been on the front lines of this pandemic from the very start. In fact, her first call today was to transport a COVID-positive patient to hospital.
The second wave has definitely hit hard, and we're definitely seeing the results of it.
Vanessa, who is a local president of Halton's Paramedic Union, is one of 5 emergency responders in that region to test positive for COVID this month alone.
This is the nature of our job, right? We go into unknown environments all the time. And, and that's kind of the concerning thing for us. I think the main stress has been, possibly taking this home to our families.
Peel's Paramedic Union is also venting its frustration.
The most sick patients are the ones who are calling 911.
Peel Region responds to about 300 calls a day, bringing paramedics to homes, businesses, and long-term care facilities. I'm told about 100 of those daily patients are displaying symptoms of COVID-19.
The sort of nightmare scenario is you get called for a known COVID positive patient who's short of breath, and they've got 3, 4, 5 family members there who are also coughing, febrile.
As Canada started planning for vaccine shipments, the federal government laid out a list of recommendations for the first phase and how to prioritize. It clearly states that healthcare workers in all healthcare settings who have direct contact with patients should be first in line. But the head of Ontario's vaccine rollout says it's not that easy.
We know what we have for this phase 1, and we know, therefore, we can do about 1 to 1.1 million people, depending somewhat on the take-up there. And we can't do it any faster if we don't have the vaccines.
One thing the paramedic unions have made clear to me is that they do support long-term care staff being vaccinated as soon as possible, but are hoping that the Ford government will put forth a better strategy.
Paramedics may come at a different point with other folks that are in the healthcare field. All of that work will happen to some extent by logistics, but paramedics are recognized as an area of healthcare.
As of now, it looks like paramedics will be rolling up their sleeves by March toward the end of phase 1. In Mississauga, Shauna Hunt, City News.